Millions take this supplement every single day, thinking they are protecting their bones. But what most of them do not realize is that this same supplement may be quietly damaging their blood vessels. In fact, multiple large studies over the last 15 years now suggest that the very thing we put in our bodies to keep our skeletons strong may actually be making our arteries more brittle, less flexible, and more prone to disease with every pill we swallow. And the scary part is, you may not feel anything is wrong until something serious has already started happening inside your chest. I am Dr. Sofia, a practicing board-certified primary care physician here in the United States. And in today's video, I want to walk you through the one popular supplement that I want my patients to think twice about, why the research has completely changed over the last decade and a half, who is at the highest risk, the drug interactions that nobody warned you about, the labs that I run before I ever recommend it, and what to do instead. By the end of this video, you will have a much clearer picture of why source matters just as much as dose, and why the most popular supplement in the country may not be the safe default we were all told it was. The supplement I'm talking about is calcium, and I know that sounds strange, because almost every adult in this country has been told at some point that they need more calcium. Your mother's doctor told her to take it, your grandmother probably took it. The commercials on television remind you of it every night. The women in the grocery aisles walk past the supplement shelf and toss a bottle into the cart without a second thought. Calcium is so deeply embedded in our health culture that questioning it almost feels like questioning water or sleep. But hear me out, because the science has shifted, and the very thing that we were told protects our skeleton may be quietly hardening the pipes that carry our blood, the same pipes that keep your heart beating, your brain thinking, and your kidneys filtering every minute of every day. Let me start with what calcium actually does, because it would be unfair of me to call calcium dangerous without first acknowledging how essential it is. Calcium is a mineral that your body stores almost entirely inside your bones. Roughly 99% of the calcium in your body sits inside your skeleton, giving it strength, density, and structure. The other 1% floats around in your bloodstream, and that 1% is doing incredibly important work that you cannot live without. It helps your heart contract in a coordinated rhythm with every beat. It helps your nerves fire electrical signals down their length. It helps your muscles squeeze and release. It helps your blood clot when you cut yourself so you do not bleed out. Without that 1%, you cannot stay alive. So calcium is not the enemy. Calcium is essential. I want to make sure that we do not lose that point before I get to the part that worries me. Because I am not telling you to stop taking calcium. I am telling you to take calcium the way your body was actually designed to receive it. So then what is the problem? If calcium is so vital, why am I spending an entire video telling you to think twice about the most popular supplement on the market? The problem is not calcium itself. The problem is the form in which most of us are now consuming it. Because when calcium comes in a pill, your body handles it very differently than when it comes from food. And that difference is, in my professional opinion, the single most under-discussed issue in women's health and aging medicine right now. Let me explain exactly how this works so you can picture it in your own body. When you eat calcium-rich foods, like a piece of cheese, a bowl of yogurt, a serving of sardines, or a cup of cooked kale, calcium arrives slowly. It comes packaged with protein, with fat, with fiber, with other minerals, with vitamins that help regulate how much of it actually gets absorbed. Your gut absorbs it in a controlled way. Blood calcium rises gently, like a small wave, and your body has time to send that calcium exactly where it needs to go. Into the bones, into the teeth, into the storage sites. Everything works in a coordinated, regulated rhythm. The body is in charge. The body is making decisions. The body is saying, I need a little here, a little there, send the rest to storage. Now compare that to what happens when you swallow a calcium supplement, especially the kind that most people buy at the drugstore, the calcium carbonate tablets, the antacids that contain calcium, the chewables that promise 1,000 milligrams per serving, the once-a-day tablets your sister left on your counter last Christmas. When you swallow one of these, you get a concentrated bolus of calcium that hits your bloodstream within 30 to 60 minutes. There is no slow ramp. There is no fiber to slow absorption. There is no co-regulation by other nutrients. Your serum calcium level shoots up quickly, much faster and higher than it ever would after a meal. And here is the part that I think most patients are not hearing from anyone else. That sudden spike matters. It matters a great deal, because your body did not evolve to gulp calcium like that. Your body evolved to receive it slowly, with friends, in a meal, alongside everything else. When serum calcium rises sharply, the body has only a few options for where to put it. It can absorb it into bones, which is what we want. It can store it in soft tissue, which is not ideal. Or it can simply deposit it wherever it lands. Over time, with daily spikes, calcium begins to settle into places it was never meant to go. And the most concerning of those places is the inside lining of your arteries. This is what medical researchers call vascular calcification. And let me say that word slowly, because it is the central idea of this entire video. Vascular calcification. It means calcium building up inside the walls of your blood vessels, the same vessels that are supposed to stay flexible and elastic, so blood can flow smoothly to your organs. The same vessels that expand when you exercise and contract when you rest. The same vessels that deliver oxygen to every tissue in your body. Now imagine what happens inside that hose when calcium starts to deposit along its walls. Slowly, over years, the hose becomes stiffer, it loses its flexibility, it develops small, hardened bumps along its interior, blood flow becomes turbulent, the vessel wall becomes inflamed. The plaque that sits underneath that calcium becomes more dangerous, and over time, the artery that was once soft and responsive becomes something closer to a rusted pipe. This is the picture researchers are now painting for people who take calcium in pill form year after year, especially in high doses, especially without lab guidance, especially alongside vitamin D. Now the question I always hear at this point is, what does the actual research say? And I am glad you asked, because this is not a single study, and it is not an opinion. This is a consistent pattern across multiple large analyses that I take very seriously. Let me walk you through 3 of the most important ones, because I want you to hear this the way I would explain it to a patient sitting in front of me in the exam room. The first is a meta-analysis, led by Dr. Mark Bolland at the University of Auckland and published in the British Medical Journal back in 2010. He pulled together 11 randomized controlled trials, totaling more than 12,000 participants, all of whom took calcium supplements without vitamin D. The result was striking. Calcium supplement users had a 27 to 31% increased risk of heart attack compared to those who took a placebo. The findings were statistically significant, and the author concluded, and I am going to quote this directly, that calcium supplements increased the risk of myocardial infarction. Let me say that again because the number deserves a second hearing. 27 to 31% increase in heart attack risk in people taking calcium pills alone. That is not a small effect. That is a serious, measurable signal that has been replicated multiple times since. The second major piece of evidence comes from the multi-ethnic study of atherosclerosis, sometimes called the MESA study, which has been following thousands of American adults for over a decade to track how their arteries change over time. The research team looked specifically at calcium intake from diet versus supplements, and they asked one simple question over 10 years of follow-up. Does the source of calcium matter for the health of our arteries? And the answer surprised a lot of people. Dietary calcium was not associated with worsening coronary artery calcium scores. In fact, people who ate more calcium-rich foods tended to have cleaner arteries over time, but calcium from supplements was a different story entirely. Supplement users showed greater progression of calcium buildup inside the coronary arteries over the 10-year follow-up. So food protected the vessels. Pills did the opposite. The source mattered, and it mattered a lot. Let me say that again. Food protected the vessels. Pills did the opposite. The third piece of evidence is a study published in the Journal of the American College of Cardiology by Dr. Nur Bazarbashi and his colleagues, sometimes referred to as the ME-HEART study. This study followed patients with established coronary artery disease who were already undergoing serial imaging of their arteries. They found that oral calcium supplementation was associated with greater progression of coronary calcification, independent of other cardiovascular risk factors. In other words, even after accounting for cholesterol, for blood pressure, for age, for smoking, for diabetes, the calcium pill itself was still independently tied to more calcium depositing inside the arteries. That is a very strong signal. And there are more. A separate meta-analysis by Dr. Sung Kim Young and colleagues in the journal Nutrients in 2021 found that calcium supplements increased cardiovascular disease risk by roughly 15% in healthy postmenopausal women. A separate analysis by Huo and colleagues published in 2023 looked at the question broadly and confirmed the direction of the effect. A reanalysis of the Women's Health Initiative data also pointed in the same direction. These are not fringe findings. These are peer-reviewed publications in some of the most respected medical journals in the world. And when I see this kind of replication across independent research groups in different countries, using different study designs, looking at different populations, all pointing the same direction, I pay very close attention. The signal is real, the signal is consistent, and the signal deserves your attention. So now we have to ask the harder question: who is at the highest risk? Because this is not the same risk for everyone. Let me walk through the groups I worry about most in my own clinic, the groups where I am most cautious about calcium supplementation without thorough evaluation. Number 1, postmenopausal women. This is the group that has been most aggressively marketed calcium for decades. The framing was simple: lose estrogen, lose bone, take calcium, save bone. But this is also the group where vascular calcification risk accelerates with age and with the loss of estrogen's protective effects on the vessel wall. So they are doubly exposed, both more marketed to, and more biologically vulnerable. Number 2, older adults of any sex. As we age, our arteries become less forgiving of sudden calcium surges, the mineralization threshold drops, the vessel wall becomes less responsive. The same pill that may have been tolerated at 50 may behave very differently at 70. Number 3, anyone with existing atherosclerosis. If a person already has plaque building up in their arteries, more calcium in the blood means more potential for that plaque to harden, which is what we call calcified plaque. Calcified plaque is more brittle than soft plaque, and is associated with a higher risk of certain types of cardiac events, particularly plaque rupture. Number 4, people on thyroid medication or proton pump inhibitors. Both of these medication classes can affect how calcium is absorbed and metabolized, and patients on these drugs frequently end up on calcium without anyone reviewing the totality of the picture. Number 5, anyone who takes calcium with vitamin D without checking with their physician first. Vitamin D increases calcium absorption, which sounds like a good thing, but if you are already getting adequate calcium from food and you add a pill plus vitamin D, your blood calcium can rise even higher than it would with calcium alone. So the combination that the supplement industry markets as a package deal is actually the combination that worries me the most when it is done without labs. And number 6, people who take large single doses. If you take your calcium once a day in a single 1000 milligram pill on an empty stomach, you are creating exactly the kind of spike I warned you about earlier. Splitting the dose, if you must supplement, at least reduces the magnitude of the surge, but it does not eliminate the underlying source mismatch. There is one more interaction I want to flag here because it comes up constantly in my clinic, and it is rarely discussed anywhere else. Calcium supplements taken with certain prescription medications can quietly change how those drugs work. Calcium can interfere with the absorption of thyroid medication like levothyroxine, with iron supplements, with zinc, with some antibiotics in the tetracycline and fluoroquinolone families, and with bisphosphonate drugs that are commonly prescribed for osteoporosis. So a patient who is taking calcium for her bones while also taking a bisphosphonate for the same bones is essentially working against herself and wasting the effect of the more expensive prescription drug. This is the kind of thing I catch on medication reviews every single week. And it is why I say this particular supplement demands a real conversation with your doctor, not just a casual purchase at the pharmacy. Now I want to be fair here, calcium supplements are not poison, there are people who genuinely need them. I am not saying that literally no one should ever take one. There is a place for supplementation, there is a place for therapeutic use under supervision. Let me talk about who actually needs it, because that list is much shorter than the supplement industry would like you to believe. Postmenopausal women with confirmed osteoporosis or osteopenia diagnosed by bone density scan. Adults with documented calcium deficiency on lab testing, not just a hunch, not just feeling tired. People with medical conditions that impair calcium absorption, such as celiac disease, inflammatory bowel disease, or those who have had bariatric surgery and can no longer absorb calcium well from food. And individuals on long-term corticosteroid therapy, because steroids actively leach calcium from bone and put patients at high fracture risk. Outside of these situations, supplementation should be a thoughtful, lab-informed decision made with your physician, not a casual monthly habit picked up from a magazine or a friend at brunch. Now let me give you the practical plan, because the point of this video is not to scare you. The point is safer default. This is what I tell my own patients, and this is what the science supports. Let me walk you through it step by step. Step 1, and this is the cornerstone of everything else, get your calcium from food first. The foods that deliver calcium in the natural packaging I described earlier include dairy products like milk, yogurt, and cheese. Yogurt is particularly good because it comes paired with protein and other minerals that improve absorption. Sardines and canned salmon with bones are an excellent source that most people overlook entirely. Leafy greens like kale, bok choy, turnip greens and collard greens are loaded with calcium and come with the fiber and the co-nutrients your body needs. Fortified plant milks, tofu made with calcium sulfate, and certain beans also contribute meaningfully. Aim, for most adults, for roughly 1,000 to 1,200 milligrams per day of calcium from these whole food sources. Most people who eat a reasonable varied diet can hit this without ever touching a bottle of supplements. Step 2. If you and your physician decide you do genuinely need to supplement, choose the form carefully. Calcium citrate tends to be absorbed more gently than calcium carbonate and does not require stomach acid for absorption, making it a better choice for older adults and for anyone on acid-reducing medications. Avoid taking more than 500 milligrams at a time. The body simply cannot handle a larger bolus gracefully. Step 3. Take calcium with food. Taking it with a meal slows the absorption curve and reduces the magnitude of the serum spike. This is one of the simplest changes you can make if supplementation is unavoidable. Step 4. Get a baseline. Before you ever commit to long-term calcium supplementation, ask your doctor for a basic metabolic panel to check your serum calcium level, a vitamin D level so you know how much help you have absorbing whatever calcium you take in, and if you are a postmenopausal woman, a bone density scan to actually measure what your bones are doing. These 3 pieces of information tell you whether you actually need calcium, how much vitamin D you have to help absorption, and what your bone status really is. Without that data, you are supplementing blind. And supplementing blind is exactly how we got into this conversation. Step 5. Do not take calcium at the same time as your thyroid medication, your iron supplement, your zinc supplement, or your antibiotic if you are on one. Calcium interferes with absorption of all of these. Space them by at least 2 to 4 hours. This is one of the most common mistakes I see in clinic, and it silently reduces the effectiveness of other important medications. Step 6, and this one often gets forgotten. Prioritize your vascular health with the same intensity that you prioritize your bone health. Walk daily, reduce ultra-processed food, keep your blood pressure controlled, manage your cholesterol, sleep 7 to 8 hours, stay hydrated, manage your stress. Because here is the painful truth that nobody likes to say out loud. If you save your bones for 30 years but lose your heart in the process, you have not actually won. Longevity is not just about how long your skeleton lasts. It is about how long your arteries stay flexible, your brain stays sharp, and your heart keeps beating with strength. The bottom line on calcium is this. Calcium is essential for human life. Calcium from food is the safest and most effective way to keep your body supplied. Calcium from supplements can increase the risk of heart attack, can accelerate coronary artery calcification, and is associated with greater vascular harm, especially when taken in large single doses over long periods of time. The source matters, the dose matters, and your lab values matter. This is the one supplement where I always want to see my patient's labs before recommending it. There is one more thing I want you to take away from today's video, and it is something I say in clinic almost every week. We have spent decades in this country treating symptoms of aging with bottles of pills. And some of those bottles are useful, but many of them are doing harm on a different side of the body that we never checked. The medicine I practice today is slower medicine. It is medicine that asks, what is this going to do to the whole person, not just the one number we are chasing? You deserve that kind of care, and you are capable of understanding it. Now if you found this video useful today, and you want a simple but comprehensive plan that walks you through how to protect your bones, your arteries, your metabolism, and your brain all at the same time, I have put everything together in a free guide I call the Longevity Blueprint. It is the exact framework I use with my private patients, and I am making it available to you at no cost. If you would like a copy, just click the link in the description below. And finally, the simple believe anything, but the prudent give thought to their steps. This is from the book of Proverbs, chapter 14, verse 15. Take care of yourself, and I will see you in the next one.